Welcome to Advanced Nurses. We connect with nurses who inspire other nurses by sharing their experiences. And so we're able to bring that information to you.
Welcome. Here's a word from the educational consultant at Advanced Nurses at ACD4N.
I wanted to give some advice to nurses, and I'll just start with myself. So when I started this service, when I started my company because I wanted to be a resource to nurses. I found that in my years of research and in nursing education and my studies as a master's prepared nurse educator, I realized that nurses really didn't have a lot of resources for advocacy. And the job market has gotten pretty tight, if I would want to use that word, and to the extent where even in hospitals, and I think that this speaks to the conversation around ratios that nurses have been yelling about for decades now. But we've seen that kind of early signs of it through those problems nurses have been expressing around ratio. Whereas hospital systems, like many other companies, are trying to see how much they can get out of a small group. And so, whether that's bringing in uh, international staff to come and do these assignments at a lower rate and possibly still work the same hours, if not more hours. So every company is trying to figure out how to do that. So what I find is a lot of nurses who know that things could be better or recognize the opportunities to improve things, they become stressed out and burnt out in their roles. And so having a resource to know how to transition, ways you can transition, processing it. This is the reason why I have my journal as well, my transition journal that that's a free complimentary resource that I would just love nurses either to download it and use it like the PDF to write on it, or download it and print it out and have it as your own personal resource. Because I think what happens to a lot of nurses is nurses are not really realizing you really do need to kind of have a plan, an exit plan. You need to really think about what is going on with your life, your professional life. And if you're in a workplace that is no longer feeding you, what are you really getting from being there? Now, for some people, they say, well, I'm just there for a check. If you're there for a check, but you're working on something else, then go ahead, just be there for a check. But oftentimes, because work takes up so much of our day, if you are working a full-time job, even if you're working a part-time job or per diem role, work takes up so much of your work, of your day and your identity, that I feel that it's a risky decision for you to just assume that you could just go to work and it's like it's not going to have any impact on you. I find a lot of people who have been kind of trying to get back to school, trying to pick up that momentum, it becomes more and more difficult the more hours they pick up at work, or if they have been working within a role that's draining them for a very long time, it becomes harder and harder for them to transition and shift to other things they want to do in their life. And so that's something I observed in nurses. I've observed it in my family. I've observed it with friends. I've observed it with clients, people who reached out to me to ask me for guidance around what they should do with their nursing career. And I find that this is truly a pattern, people just not really knowing how to transition. And so the first thing I would probably want to encourage anybody to do is, if you truly want to transition, you need to be able to document or like have some way of recording, which is one of the reasons why I started this service here, as a means of kind of documenting my progress, documenting the experiences of other nurses, and putting that out there so that nurses can be able to digest this and know, like, there's someone out here who has experienced that too. That's not a, uncommon feeling to be at work and saying, I love my job as a nurse. I just, don't feel like I'm being appreciated the way I should be appreciated. Or I feel like, people take my ideas and don't give me credit. This happens even in corporate nursing roles, just like any other corporate environment where you have really eager, smart, dedicated individuals who may be managed by people who want to take their ideas and run with them, and not necessarily turn around and give credit where credit's due. That happens everywhere, not just in nursing, but a lot of nurses who have transitioned away from the bedside may see some of these patterns because the work looks very different when you're away from the bedside. When you work away from the bedside, you tend to deal with a lot more of the corporate bureaucracy stuff. Not saying that you don't deal with it at the bedside, but a lot of times nurses who are working at the bedside, they are very much caught up in the whirlwind of that patient's their patient caseload, or their or the patients that they're caring for that day, that their assignment. They're very concerned about whatever treatments and medications are common to their unit. So a lot of that kind of distracts them from looking at the operational stuff that's happening around them. And I can just say, as a nurse who have gone from case management to working more in operations and working more so in like health information management and utilization management, I can tell you that there is so much more that nurses really can do to be dynamic. And I find that, again, it's harder and harder to transition if you don't know those skill sets that you need to like really claim early on in your experience as a nurse, or things that you need to focus on developing in the future. Like, one of the things is nurses being comfortable with technology. And I say that a lot, but when I say being comfortable with technology, I'm not just simply talking about nurses just saying, oh, I'll have a computer, or I love technology, or I love using Bluetooth, you know, enabled devices. It's like, it's beyond that. It's like understanding that like templates in EHR systems, they are designed that way for a reason. Um, you know, how can they be improved? Are we collecting information on patients that we should be using to make business decisions outside of patient care, but we're not really thinking about that because no one told us to do it, so we won't offer our input or our suggestions because we see those opportunities. Are we collecting information that really is not useful at all? We're collecting it, but it's not really helping us make any decisions. So maybe should we not have that collection be emphasized as much because we're not really using that information? And so these are like ways that you can think of in a more technical way. Um, and again, some of that is just critical thinking. You don't necessarily need anything besides a paper and pencil. Not saying that technology necessarily means that you have to go beyond a paper and pencil. There is a lot of technical work that goes into writing a plan. And I feel like, nurses need to learn how to be both like more technical in their approaches, also comfortable using technology, right? So using whatever software or programs that we have in place, including EHRs, including spreadsheets, to help us, and dashboards to help us make decisions about our patients, especially when we're talking about things that are more predictable. So we're looking at trends over time and considering the different variables that maybe increase the likelihood of something happening or decreases the likelihood of something happening. If it's an undesirable outcome, then we probably want to look at, how can we prevent this particular thing from happening, or how could we, promote this positive thing from happening more often. And so a lot of that requires nurses kind of stepping away from providing that hand touch care and looking more broadly at other parts of how we, or maybe looking at from a more macro perspective, what are some other ways that we influence healthcare that doesn't necessarily mean touching the patient. And so it's important. A lot of times people hear like non-traditional nursing roles or non-bedside roles, and immediately the negativity comes up, the flags, starts flying up, and the conversation starts going into, oh, you hate being a nurse. And it's not that I don't think anyone should question if they want to be a nurse or not. I've been a nurse for over 13 years and never worked in a hospital a day of my life. That was never my goal. That was never my ambition. Nurses do more than work in the hospital. And see, that's another part of that evolution. Like, I'm a breathing, living example of the evolution of healthcare. I was just a little bit before my time because the conversation of non-bedside roles has become more popularized with the use of social media platforms as a means for nurses to express themselves. So you see more nurses talking about that, but then you also see a lot of companies, especially after the few years after the international emergency, the pandemic. Following that, it was like a bunch of companies, startups really started to emphasize using nurses in non-traditional ways, and so there's a lot more conversation around non-traditional nursing roles. And I'm just saying, for over 13 years, I already knew that that wasn't the space that I wanted to be as a nurse. And it is a very uncomfortable thing because there are people, nurses, who will shame you for not having that interest and not realizing, like, that's also one of the barriers in nursing. That, when nurses say they want to get better pay and respected, you have to understand that means that you as a nurse have to respect other nurses too. Like I don't know if sometimes we realize that we're on the worst enemy because we are the ones telling people, oh, such one's a nurse. I didn't know they were a nurse, and they have them up in the C-suite. Oh, they don't know what they're doing. Like those kind of messages. Or sometimes it could be a little bit more covert, where you have someone who's kind of undermining you. When if you're a nurse in a leadership position and somebody comes around and starts telling people not to listen to you, or you're not an authority in that area, or they want to humiliate you and show people what you don't know and things like that. And all of these are like these little indicators that, to me, those nurses who are doing that, they're behind, because they're not realizing, like, no, when you see nurses with diversified skill sets, like, process that as, oh, this is somebody that we can learn something from, because she's not doing that typical nursing thing. She doesn't have a typical nursing background. So therefore her perspective on things are going to be a little different. If we start embracing that internally as nurses and stop the gatekeeping and stop all the copy and paste behaviors, because sometimes we have this idea that we have these 5 or 10 nurses that are role models, and we think that we're going to mimic every single step that they have taken. And it's like, no, you still need to bring in who you are and be comfortable with who you are and promote that in other nurses, for nursing overall to benefit from how, like, the dynamic nature of nursing. Nursing is dynamic. So when a nurse says that they have not worked in a hospital has been a nurse for over 13 years and have not worked in a hospital, that should be something that nurses should be proud of, because then you're showing people, like, look, nursing is so dynamic that you don't have to work in a hospital. Now that doesn't mean I have never stepped a foot in a hospital. That doesn't mean that I don't go to hospitals on a regular basis to work with patients on my panel, or a providers panel. But I don't think that I have to be inside of a hospital and checking into a hospital, or had to check into a hospital for years for me to be a nurse. That's how dynamic nursing truly is. And so my encouragement really is just for nurses to think about, what does that next step look like? And if you are new to nursing and you're saying, there's a lot of things that I've seen in nursing that I don't like, you are learning the basics in nursing school. Your first nursing job, you're still going to be processing, what is this whole thing called nursing. It's not until you're in like 5, 10 years down that you're going to really realize, okay, nursing is dynamic. You'll meet nurses who are doing non-traditional nursing roles, or maybe traditional nursing roles, but they're working in specialty areas that you never thought about. These are the kind of things that it's like, make a note of it. Instead of cutting that person down or questioning that person's authority or listening to the other naysayers, take a note of what you see that person doing. If there are skill sets that you see that they have mastered, or that they're trying to master, or that they're focused on, and it draws to you and it's appealing to you, find out, how do you get to understand that more. I was drawn to health information management because I'm a very analytical person. I'm also very creative in my thinking, but I'm also one of those individuals. I love what I say and do to be like fact and, truth based. So for me, having the resources, such as the access to the information to make that decision, and having that information be based on data. So, like, not just a collection of the information, but information that we can actually process and look at trends over time. For me, that allows me to make better decisions around care coordination, around education and training for the medical team and the healthcare team that I'm working on, because I don't even think that I need to be a manager to educate, and neither do I think any nurse needs to necessarily go to school and get a master's in nursing education to be an educator. I mean, when I say educator, I'm talking about to educate family, the patients' families, and the patients, and even their peers. Around if there's some new breakthrough treatment or breakthrough medication, I think nurses should feel confident to have a way of reporting on their knowledge and be comfortable with sharing information. And if there's opportunity to do presentations or to be a part of committees, move towards that. But I do think that there's something to be said if you notice a lot of gatekeeping. Like when opportunities like that are suggested, you see people kind of directing you away from it because it's just not a priority for them. And so that's just something to think about if you are interested in transitioning away from bedside. It's not uncommon. It's not uncommon to get through nursing school and still not find your specialty area. It is not uncommon to get through nursing school and think, I already have my mindset. I want to go straight in HIM. I want to go straight in informatics. I want to go to be a nurse practitioner. There's nothing wrong with any of those pathways. But I will say, just be prepared. There are nurses who will judge the decisions you make. I'll admit for myself, when I first learned about nurse practitioners getting doctorates or even PhD nurses who wanted to be referred to as doctor this or doctor that, I initially was a little cringy about it because I looked at it and I thought to myself, well, how come the emphasis is not on how proud they are to be a nurse? Why is it that well, I have a doctorate by title, I would like to be referred as by doctor? And it's still, that whole thing is completely and totally debatable in the sense where, are doctors the only medical doctors, are they the only ones that should be called doctor, the quote unquote term doctor? We call professors, I've called all my professors, whether they were teaching history, music, whatever, art, if they earn a doctorate, I refer to them as doctor this or doctor that. So it is very debatable, this whole thing around should you use that term or not. I think it's more important to express to your patients that you're taking care of, hey, I'm a nurse practitioner. Such a one is a doctor that I report to. You can say that in a very, just like how the doctor probably would say that to the patient. If the patient and the doctor are at a visit and the doctor is like, well, next week I won't be here. Um, Mary Sue, she's the nurse practitioner here. She will be the person that will be able to see you for X, Y, and Z. And however that practice decides to utilize their providers and their physician, then at whatever that dynamic and relationship is like, sharing that with the patient so the patient is able to make an informed decision. Maybe the patient says, I don't know if I really know too much about what a nurse practitioner can and can't do, or a physician assistant can and can't do. What are the limitations? What are the similarities between them and physician? And because again, we know the scope of an actual encounter and visit has a different um, there's different indicators around what that looks like as far as like a quality visit or what you need for that visit. You don't need to have a medical doctor going through medication that a person has been taking for years. But if that person does need, that patient needs that kind of intervention, they need education, and it's beyond just the nurse that took it took their vital signs or explaining their vital. If they need something more on a provider level, maybe there's a conversation around looking at indications for this patient to maybe be switched onto a new medication. Maybe that is something that a provider can do. When I say provider, I'm talking about this distinguishing them from a physician. Maybe that is a visit that the provider can have that doesn't require the physician, and the provider can now report that back to the physician. The physician can say, okay, you know what, let's explore this medication, and have that provider do that. I've worked at places before that, but the provider, the physician there, she was she's the CMO. She worked in a practice that had, I want to say, I would like to say there was maybe about 500 clients that we were seeing. Maybe that was a complete total caseload, but these are people who were like regularly coming in for their appointments. And I remember creating schedules for the providers where sometimes it would almost look like 10 or 15 people in an entire day. You already know that those individuals are not going to be getting like their handheld, through those visits. So myself, um, as a lead nurse, and then there was an LPN. She was the other nurse there, so she would administer the medication. A lot of times, I would be doing more so that background work around preparing them for their visit. Then they would see the therapist, and they would also see the psych NPs. And so that's essentially what the whole thing was like. Those psych NPs were bombarded. I could try to slow down, the patients a bit by providing education to them around their medication adherence and doing trainings with them around how to properly administer medications or provide education around adverse side effects. I could do that, and then the LPN there, she could provide the medications, whether they were injectables or whether they were oral meds. And we worked like that, but it still was a very tight crew. And those psych NPs were overwhelmed in many cases with how many patients they had to see. We're talking about a population that sometimes they themselves are very overwhelmed and disorganized. So, sometimes they need their medication, sometimes they go without their medication and they don't think they need it, but they need it because their families call them and saying, look, such a one needs their medication really badly. People are missing their appointments because they're having these psychiatric, these like episodes, whether they're having manic episodes or some depressive episode or something that is preventing them from thinking clearly about managing care. So I've seen it all. And again, it's really about having the right kind of support in place if you want to transition into these other roles, and understanding like where you're going to, understanding what their process looks like, understanding what's the dynamic of, that provider. Because the provider in that case, the story I was just mentioning there, that place I worked at, the provider, she seldom was available. And so she rested a lot on those psych NPs. And so there were times where if she was present, she could probably lighten the load, but she dealt with them like they could deal with everything. She could just do the high level stuff. She could just show up once a week and just nod heads, or maybe a few hours in a day, and she would go off and do her own thing. And so these are the kind of things you need to be aware of anywhere you work at, as a nurse. What are the dynamics around leadership? What are the dynamics of expectation of my role? What are some things that I want to gain from this opportunity? Maybe as a psych NP, I don't want to work at a place where there's a lot of people in and out. Maybe I want to work at a place that's like in a rural area where there's less clients. Maybe I want to work at a place where it's high paced, and so I'm staying busy all the time. You have to think about what it is that you want and what you're interested in. I'm still figuring out what I truly want to get, like the full picture from the NP program. I know first thing that I really want to gain from the NP program is I want to really gain a deeper understanding of what providers do around differential diagnosing. I want to understand more about psychiatric medications, which I've always been kind of enamored by, but I'm always curious to know more. And so that's what I'm looking forward to. I hope that you are looking as a nurse, you're looking at the different opportunities for you to learn, grow, and advance around you. And never limit yourself to just saying, well, I'm just a nurse. Or, they're dealing with me like this because that like that's within my scope. I'm supposed to take this. No, you're not supposed to take people yelling and screaming at you. You should be able to know when you've learned enough at a job and you need to move forward and move on with your life. And that's also a very common thing across all industries. When you feel that you're not being appreciated, you need to know when you've had enough and it's time for you to go. So these are just some things to think about. Again, I'll keep everyone kind of in the loop about my progress here as I embark on this new journey. Peace.
If you are interested in learning how to advance your nursing career by leveraging your nursing knowledge in a non-traditional role, enroll in our transition coaching program and download a free copy of our My Transition Journal today.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com or visit our websites www.advancednurses.info or www.acd4n.com.